Hi, my name is Nora and I work for the Daly City Youth Health Center. Today I'm going to be talking about the options a person has if they discover they are pregnant and do a little brainstorming about how someone might decide. The first option I'm going to talk about is abortion, which is ending a pregnancy by removal of an embryo or fetus from the uterus. There are two types of abortion. There's the medication type, also known as the abortion pill. This must be done within the first 10 weeks of pregnancy. The patient is given two medications. The first causes the body to stop making the endometrium, and the second causes the pregnancy to leave the uterus, kind of like when tissue leaves the uterus during a period. The process can take a few days. The second type is called the aspiration type or the suction abortion. Most are done within the first 16 weeks of the pregnancy, but can be done up to 24 weeks. This procedure is performed in a clinic or doctor's office using a vacuum aspirator to empty the uterus with gentle suction. Later term abortions are allowed in rare cases, like if it's a threat to the mother's life, there's a severe birth defect, or a late term miscarriage, and your doctor will follow up after either type of abortion. So abortions in California. In California, teens do not need parental notification or permission to obtain an abortion. And both types of abortion can be paid for through Medi-Cal or emergency Medi-Cal here in California. The Daly City Youth Health Center does not perform abortions, but we have counselors who can refer a patient to local clinics that do provide abortions. There is a misconception that only young people who made a mistake need abortions, but there are many reasons an abortion is needed, including reasons that are out of our control. For example, an accident, like say if the condom broke, or force, in the case that a sexual assault leads to a pregnancy. Birth defect, limited or no access to birth control, if the person does not want to be a parent or is not ready to be a parent. Maybe they can't afford to raise a child. Having a child costs a lot of money over the course of 18 years. Perhaps they're not healthy enough or do not want to go through a full pregnancy or childbirth. This can be especially hard if the person is a regular alcohol or drug user. Maybe there's not a safe environment for the baby, like an abusive home or a war. And even if it was an unplanned pregnancy, we all have bodily autonomy, the right to make decisions about our own bodies, and pregnancy should not be used as a punishment. So everyone has different values around abortion. Some people believe abortions are killing a baby. Medically speaking, it is not a baby yet until it has been born. But regardless of our different values around abortion, we have to be aware of the impact of this kind of language. Why? Well, it promotes a lot of shame for those who need or want an abortion. Ultimately, it's up to the pregnant person to make the best decision for them. But if they are pressured by other people's opinions, they may not make the best decision for themselves. Are abortions safe? People often wonder this. And yes, they are very safe. 99.95% of abortion patients do not experience serious complications. Legal abortions do not affect the ability to have healthy pregnancies in the future. For example, infertility, miscarriages, birth defects. And abortions are made safer by access. Consider rural places or states without clinics, or states that don't cover the cost. If legal abortions are inaccessible, it doesn't stop people from needing abortions. It stops them from getting safe abortions. Consider how desperate a person is to get an illegal abortion with improper and unsterile tools. Illegal abortions are extremely dangerous and can lead to serious infections, infertility, and even death. Limiting access to legal abortions disproportionately affects low-income people because they have fewer resources and options. This is a friendly reminder. Please fill out the question about abortion on your handout. And feel free to pause the video to give yourself time to write. So the next option a person has is called adoption. So and the definition of adoption, when a person legally takes on the rights and responsibilities of a child who is not biologically born to them. The decision is permanent once the adoption procedures are completed. So there are two types of adoption. There's an open adoption where the birth parents can be involved and have some contact with the child throughout their life. This might mean like sharing pictures, seeing them once a year, maybe monthly phone calls. And the birth parents decide the level of involvement that they want to have. A closed adoption is where there is no contact with the adoptive family and child. Birth parents can choose an adoptive family or let an agency choose for them. And please note that in either type of adoption, the adoptive family or agency can help with any expenses, hospital documents, and counseling. So some reasons a person may choose adoption, they do not want to be a parent. Maybe they're not ready to be a parent. They can't afford to raise a child because, like I mentioned before, having a kid is very expensive. And again, maybe there's not a safe environment for the baby. Maybe they don't want to get an abortion, but they know they can't raise a child. So there are common misconceptions that choosing adoption is abandoning a baby or that adopted kids are unwanted. But in reality, choosing adoption is a loving and selfless act. Parents who put their child up for adoption recognize that they can't give their kid the life that they deserve. So they lovingly give up their child to a family that can provide them with everything. Also, if someone wants to adopt, they have to go through a rigorous screening process, so we know that adoptive children are very wanted. This is a friendly reminder to please fill out the question about adoption on your handout. Again, you can pause the video to give yourself time to write. Okay, the third option we'll talk about is parenthood. This is when a pregnant person raises a baby alone, with their partner, and or with the help of family or friends. Okay, so just to be clear, a teen has the right to continue their pregnancy, regardless of marital status, income level, whatever. They have the right to continue the pregnancy if they choose to. A less involved parent may be required to pay child support. And for anyone choosing parenthood, there are many local community resources for new parents, such as TAP, Teenage Parenting Program, Women, Infant, and Children, WIC, prenatal to 3, which will support you until your child is 3 years old. So some reasons a person may choose parenthood. Maybe they want to be a parent, and maybe they're feeling ready to be a parent. If they have the resources and support necessary, or maybe their cultural values or personal beliefs around pregnancy and parenthood mean that they are choosing parenthood. Perhaps they don't want to get an abortion or choose adoption. So this is a friendly reminder to please fill out the question about parenthood on your handout. Again, you can pause the video if you need more time. So we have just talked about the 3 options someone has when they are pregnant. But what if you choose parenthood and after giving birth realize you're not ready to be a parent? So this is the safe surrender symbol. And please note, it is not the baby changing symbol that you see in bathrooms. So the safe surrender law in California says that the parent or lawful guardian of a newborn 3 days or younger may bring the newborn to a safe surrender site. And this is confidential unless there is suspected abuse, like if the baby has like bruises or cuts or something like that. They have 14 days to change the parent. They have 14 days to change their mind. Otherwise, the child will be placed within the foster care system. So safe surrender sites include hospital emergency rooms, fire stations, or other locations with a posted safe surrender sign and that have 24-hour medical care. Just to be clear, this is an emergency option, the safe surrender. So how does a person decide? Sometimes deciding what to do about an unplanned pregnancy is easy. And other times it's difficult or complicated. The decision is very personal, and everyone's situation is different. So here are some things to consider. What are my personal beliefs around pregnancy or abortion or parenthood? Is anyone pressuring me to make a certain choice? Am I ready to be a parent? Do I even want to be a parent? Can I financially and emotionally raise and provide for a child for the next 18 plus years? Again, like I said, having a child is very expensive over the course of that time. Um, it is a difficult process raising a child. Um, am I healthy enough or ready to go through pregnancy and childbirth? Again, considering aspects such as diet, exercise, mental health, um, alcohol, and drug intake. Are you feeling ready and up for the challenge? And would my decision change my life, career, lifestyle goals in a way that I don't want? So just to let everyone know, if someone is choosing is choosing to go through with having the child, whether they're giving it up for adoption or whether they are going to choose parenthood, it's very, very important that they start prenatal care. Pregnancy is really hard on the body. You're growing another person. And prenatal care should start early in the pregnancy. It consists of periodic checkups with the doctor to ensure the pregnancy is developing normally, and continues until delivery. It's very, very important. Prenatal care. So also, please remember that babies need unconditional love. It is our job to love them, not a baby's job to love us. And to help a friend in this situation, it's important to give accurate, non-judgmental information and not let our values tell them what to do, because ultimately they have to make the best decision for them. And please know that no one can force you to choose or not choose abortion, adoption, or parenthood. It is always the right of the pregnant person to decide what they do with their body and what option is best for them. Thank you.